Alright, so we're going to do the assessment on the head, face, eyes, ears, neck, and nose. So first off, it's going to be you're looking at the head to see if the contour's symmetrical, if there's any abnormalities. Next, you're going to palpate the head and feel for any lesions, any other lumps or bumps, measles or mumps. Okay. So next, so that was all good. The symmetry's good. Next, we're going to feel for the temporal arteries and see if we can feel those or if there's anything wrong with those. Those feel fine. Then we're going to assess the TMJ. So can you open your mouth for me? Good, close. Good. So there's no crepitus there, so that sounds and feels good. So now we're done with the head, we're going to move on to the face. So I'm looking at his face and seeing if there's any tics, any lesions, any abnormalities in his facial expressions, if he's grimacing, anything like that. And then I'm going to have him do some movements to see if they're symmetrical. So can you raise your eyebrows, squint your eyes, can you smile for me, frown, show your teeth, good, and then puff out your cheeks. Okay, good. So everything on his face looks good, no tics, nothing like that. So now we're going to move on to his eyes. So we're going to do the cardinal fields of gaze, which is you're going to go 6 different directions and have his head stay still and just have his eyes follow you. So if you could just look at me and keep your head still and follow my finger. So you're going to go up, directly to the side, down to the side, and then the other way. Good. So you're just seeing if he can track your finger and if his eyes follow you in every single one of those directions. So next we're going to do Pirlo, so we're just going to see if his pupils accommodate as well as if he can follow your finger as you move it closer to his face. So if you could just look directly at me. Yeah, a little bright. Good. And then can you follow my finger? Good. So pupils are equal, round, reactive to light, and they accommodate. So they move in with your finger as you move it closer to his face. So next I'm going to check his eyelids, eyebrows, and eyelashes. So I'm checking to see if they're symmetrical, if there's any erythema on the eyelids, if he has eyelashes, and if they're symmetrical and everything like that. Can you close your eyes again? Good. Alright, so everything looks good there. So next we're going to have the patient look upward. And you're going to, no, can you keep your face forward and just look up? And then you're going to check the conjunctiva and sclera at the same time. Good, good. So you're checking for jaundice and anything like that. So now we're done with the eyes, so we're going to move to the ears. So same with everything else, you're just going to look and see if there's any lesions, if they're symmetrical, if there's any problems with any of the ears that you can see on the outside. So his ears look pretty good. So next we're going to palpate them and see if they're tender or if there's anything wrong with them. So you're just going to ask your patient, are anything on your ear tender?
No.
Good. Make sure you get the tragus, which is the little triangle part right here on your ear. And then next you're just going to look into the ear to see if there's anything you can see. So for an adult patient, you're going to pull it up and back. So for a pediatric patient, you're going to do something different, but for an adult, make sure you pull it up and back. Good. Alright, looks good. So that's everything with the ears. Next we're going to move into the neck. So you're going to have your patient do some range of motion exercises. So first you're going to have them touch their chin to their chest, and then ear to shoulder, ear to the other shoulder. You're going to have them look one direction, turn, good, turn the other direction, and then tilt their head slightly back. Good. And then you're going to see how they do against resistance. So can you look this way for me? And then push against my hand. Good. Look the other way. Push against my hand. Good. And then shrug your shoulders. Good. So you're just testing the cranial nerve to see if there's any damage with that, making sure that each is symmetrical and that they can push against pressure. Alright, so last we're going to feel for the lymph nodes. So there's 5 places where the lymph nodes are, and you can do them in any order. I tend to go from back to the front. So you're going to do the occipital lymph nodes, and you're doing this with the pads of your fingers in a circular motion. And you're going to do the posterior auricular, the preauricular, the ones on the neck, and then your supraclavicular. Normally they wouldn't have a shirt on, it'd be a little easier to get to those. So you're just feeling to see if they're hard, if they're tender, if you can actually feel them, because a lot of times you won't be able to feel them if they're not inflamed. And that ends the assessment.